First, I'd like to warmly welcome you to our new series of transformation seminars. We have a program of incredibly eminent speakers lined up over the next 12 months, who will be looking at a range of subjects from play to early years and the impact of trauma. We are delighted that so many of you are able to join us tonight. These debates mean nothing without you, your questions, your thoughts, and we look forward to receiving these by the Q&A function. We hope that you will be inspired to continue these discussions outside the seminar with friends and with colleagues. We need this public debate. We are holding the seminars because we feel there is an urgent need for a national discussion around the mental health of children, young people, and their families. The theme of the transformation seminars is thinking differently about mental health. The seminars are a public space. They are for the interested public and professionals to join our speakers and to reflect on how we might tackle the growing problem of child and family mental health. The seminars invite speakers to respond to simple questions. What is their idea for transforming children's and families' mental health in the UK? We know that the demand for mental health support is increasing and that this need cannot be met by professionals alone. The seminars explore areas beyond clinical interventions, important though they are, to ask how we can think about and do things differently, individually, collectively, and as a society, to address the growing needs of the young generation in our complex and interconnected social world, and to tackle some of the underlying causes. As we speak, we would like to invite you to ask some of these questions. You'll see at the bottom of your screen that there is a space for a Q&A. And if you would like to submit your questions, we'll try to get through as many of them as possible if time is available. Finally, if you are tweeting, please tag us and use the hashtag #transformationseminars. And now to introduce Professor Sir Michael Marmot. If there was ever a speaker who did not need an introduction, we have him here today. We are really deeply honored to have Professor Sir Michael Marmot to introduce our new series of transformation seminars. Sir Michael is without doubt the world's leading authority on health inequalities. Michael Marmot's work can be summed up in one of his own simple but incredibly eloquent sentences. People's health suffers, he writes, because of the social conditions in which they live and work. The end goal is to change this reality. It's less easy to sum up his stellar career in the time that I have available. Professor Sir Michael Marmot has led a research group on health inequalities for the past 30 years. He is principal investigator of the Whitehall studies of British civil servants, investigating explanations for the striking inverse social gradient in morbidity and mortality, which absolutely revolutionized the field. He served as president of the British Medical Association between 2010 and 2011. He's an honorary fellow of the American College of Epidemiology, a fellow of the Academy of Medical Sciences, an honorary fellow of the British Academy, and an honorary fellow of the Faculty of Public Health of the Royal College of Physicians. He leads the English longitudinal study of aging and a number of other key research programs on the social determinants of health. He chairs the Department of Health Scientific Reference Group on tackling health inequalities. He's a member of the Royal Commission on Environmental Pollution. He has been a member for 6 years. In 2000, he was knighted for services to epidemiology and understanding health inequalities. Internationally acclaimed, Professor Marmot is a vice president of the Academia Europaea and the chair of the Commission on Social Determinants of Health set up by the World Health Organization in 2005. He won the Balzan Prize for Epidemiology in 2004 and gave the Harvian Oration in 2006, won the William B. Graham Prize for Health Services Research in 2008. Professor Mahmad held the Harvard Loan Professorship between 2014 and 2017 and is the recipient of the Prince Mayadol Award for Public Health in 2015. He's been awarded honorary doctorates from 18 universities. But with all that, Professor Marmot is just a very lovely man, a thoroughly good person. His absolute brilliance is totally committed to what is arguably the most important life and death moral issue of today: growing health inequality. This is his life's work. Within this, Sir Michael argues that mental health and many common mental disorders are shaped to a great extent by social, economic, and physical environments. Taking action to improve the conditions of daily life from before birth, during early childhood, at school age, during family building and working ages, and at older ages, provides opportunities both to improve population mental health and to reduce the risk of those mental disorders that are associated with social inequalities. He has called for universal action across the whole of society, including environmental, structural, and local interventions to prevent mental disorders and to promote mental health in the population. It is a great pleasure and real honor for me to invite Sir Michael Marmot to open the first in our new series of transformation seminars. Michael, a very, very warm welcome to a very, very special person.
Thank you, Peter. I'm touched. And it's a great honor to be at the Anna Freud Center. I wish only that it could be in person, but there we are, another time. You can see my presentation. I've had rather a busy day, and so the busyness of my day will be reflected in my presentation this evening. It's not that I didn't spend weeks preparing it, but it's very much informed by what I've been doing today. And the reason it is because Build Back Fairer was the title we gave to the report that we published today, the COVID-19 Marmot Review, the Pandemic, Socioeconomic and Health Inequalities in England. Just to give you the context, as you heard from Peter, I chaired the WHO Commission on Social Determinants of Health, And we reported in 2008. And the then Prime Minister of the UK, Gordon Brown, asked me, how can we apply the findings and recommendations of your global commission to one country, England, and commissioned me to do a review of health inequalities in England, which we published in 2010 as Fair Society, Healthy Lives. And then in February this year, 2020, we published a report, Health Equity in England, the Marmot Review 10 years on, looking back at what had happened. And we called for major changes because, as I'll show you in a few moments, what had happened was not great. And then the pandemic crashed upon us. And it seemed appropriate to revisit our 10 years on report, which was only published in February, in the light of the pandemic. Because as we think, what do we want as we emerge from the pandemic? And my argument is we need to build back fairer, not just better, but fairer. I've been showing data for a long time that health follows the social gradient. If we look at age-standardized mortality rates from all causes by where people live, classified by the index of multiple deprivation. So these are deciles of the distribution, the least deprived 10%, the most deprived 10%. And you can see for all-cause mortality, it follows a social gradient. It is certainly the case that the poorest people have the worst health, but health inequalities are not confined to poor health for the poor. It's a gradient. The less the deprivation, the lower the mortality rates. That's all causes. And there's COVID-19, an almost identical gradient to the gradient from all causes. And that means that the causes of inequalities in COVID-19 and the causes of inequalities in health more generally share a common set. In other words, if we want to understand why COVID-19 is so unequally distributed in the population, we have to understand why health is so unequally distributed in the population. I will come to early childhood and mental health, but for the moment, I want to make the case about inequalities in health more generally. This is males. If we look at females, we see the same thing, a social gradient in mortality from all causes and a social gradient in mortality from COVID-19 that's almost identical to the social gradient from all causes, just at a lower level. And if we look at ethnicity, these data published by the Office for National Statistics compared to white, Black Africans, astonishingly high mortality rate in England compared with whites, adjusting for age. But then when adjusting for geography, deprivation of the area in which they live, and other socioeconomic characteristics, that explains a good part of the excess in women and in men. Interestingly, adjusting for pre-existing medical conditions doesn't explain any of the excess in Black African origin people or in Black Caribbean. It does explain, it makes some extra contribution in Bangladeshi and Pakistani. But you can see it's not a mystery why Black African, Black Caribbean, Bangladeshi, and Pakistani groups have their high mortality from COVID-19 is because of deprivation. When ONS first published an earlier version of this, and I was on the BBC, and a minister had said, oh, he was terribly concerned about this, and people ought to wear masks and practice social distancing. And I was asked what I thought of that. I said, very good advice. And we should deal with structural racism. Yes, but what should we be doing tomorrow? Tomorrow, we should be dealing with structural racism. If most of the excess in Black, Asian, and minority ethnic groups is due to deprivation, then we need to deal with the deprivation and ask ourselves why those particular groups in society are more likely to be exposed to deprivation. When we compare what's been going on in England during COVID-19 with other countries, the picture's appalling. This is excess mortality because there's a problem doing international comparisons because of differences in the degree to which COVID-19 is diagnosed or written on death certificates. So this is looking at the prediction of how many deaths would have occurred in a given week in 2020 had the rates of the previous 5 years applied, and then looking at how many did occur, and that's the excess, and then expressing it relatively. England had higher excess mortality than Scotland or Wales or Northern Ireland, and the excess mortality was higher in England than in any other country in Europe. Observers of the US scene are all agreed that the US handling of the pandemic has been an absolute disaster, and our excess mortality is higher than in the US. Goodness. And I want now to go back to the report I published in February. Bear that fact in mind, the highest excess mortality during COVID-19. We looked at life expectancy. It had been improving about 1 year every 4 years for women and for men. That's going back to 1980. In fact, if I took it back to 1890, on average, it had been improving about 1 year every 4 years. And then in 2010-11, there was a break in the curve, and the rate of improvement slowed dramatically. In fact, just about ground to a halt. What happened in 2010? Well, yes, a new government came into power. Could I possibly be alleging that the result of a new government was a slowdown in improvement in life expectancy? Well, when we compare other countries, the life expectancy improvement annually in weeks from 2011 to 2017 was higher than it was in the UK, in Estonia, Norway, Slovakia, Hungary, Denmark, Belgium, Austria, Japan. All of these countries had a more rapid improvement in life expectancy than the UK. The only rich countries that had slower improvement were Iceland and the USA. The opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. My book, The Health Gap. In other words, as Peter said in his introduction, I'm not going to look at clinical interventions. I want to look at the conditions that make people sick. The challenge to me was to come up with a transformational idea. I'm not quite sure I did that. What I'm about to tell you is, well, perhaps a little bit fresh. It may not be quite transformational. So my argument is that health is a measure of societal success. If life expectancy stopped improving after 2010, that means society stopped improving. And pre-pandemic, what I published in February this year was the stalling life expectancy, increases in health inequalities, and life expectancy for the poorest people falling, going down, getting worse, getting sicker, shorter life expectancy. We really, really don't expect that. We expect health to keep improving year on year. And there we were. It slowed down in the improvement, increasing inequalities, and life expectancy for the poorest people falling. And the slowdown in life expectancy was nearly the slowest of rich countries. And then, as I've shown you, during the pandemic, we had the highest excess mortality. Can these two things be linked? And I think they can. And I think the link could work in 4 ways. First, poor governance and political culture. I think the governance of the last 10 years paid very little heed to health and well-being of the population, and very little heed to social determinants of health. And you only have to look at what happened to British politics after the Brexit referendum to see that we didn't pay heed to anything serious other than Brexit. So poor governance and political culture, social and economic inequalities were increasing, and as I'll show you, have increased further during the pandemic. There was a dramatic reduction in spending on public services. We are ill prepared for anything, let alone a pandemic. And England was unhealthy coming into the pandemic. I think these are key determinants of health of the population, including mental health. So let's look at what happened since 2010. The government had as ambition rolling back of the state. They didn't call it that. They called it, I don't know what they called it, putting the public finances in order. But it was austerity. In 2009-10, 42% of GDP went on public expenditure. That was about the middle of the European range. And year on year, that 42% had declined till by 2018-19, the 42% had become 35%. The government did roll back the state. And they did it in a most regressive way. The gray is spending by local authorities per person, by degree of deprivation of the area. So in the least deprived 20%, I say the gray is total local authority spending. In the least deprived 20%, total spending went down by about 16% per person. And then the greater the deprivation, the greater the reduction in spending. So in the most deprived 20%, spending went down by 32%. The greater the deprivation, the greater the need. The greater the need, the greater the reduction in spending. I showed this graph to an economist at the World Health Organization who said, "You're making this up. I've never seen anything quite so regressive as that. If we are to build back fairer, this is totally intolerable." And the government's strategy of austerity was supposed to put the public finances in order and get the economy growing. Didn't work. This is wage growth in the UK, 2007 to 2018. It was negative. The only countries that did worse than we did in wage growth were Mexico and Greece. Portugal and Italy were about the same. And then every other country had positive growth. The ideology of rolling back of the state, of making cuts in a regressive way in order to get the economy growing, was just that ideology. It was not based on sound economics. Has COVID-19 been the great leveler? Speaking of sound economics, for example, in the US, from March to September, American 643 billionaires increased their wealth by 29%. That's $845 billion from March to September. The hourly wages of the bottom 82% of the workforce in that same time declined by 4.4%. How is that compatible with a fair society or a healthy society? And the answer is, it isn't. Now, our extremes of inequality may be somewhat less than the US, but they look of that order. Poor people are getting poorer during the pandemic, and rich people, by and large, are getting richer. To come back to my recommendations in 2010, we had 6 domains of recommendations. And now let me talk about mental health. We made these recommendations having in mind both mental health and physical health. Give every child the best start in life. We said key to health inequalities throughout life is good early childhood development. Absolutely key. And that's key to mental health as it is to physical health. Education and lifelong learning. Fair employment and good work for all. And my own research has shown the importance of fair employment and good work for mental health, as well as physical health. Healthy standard of living for all. Everyone should have at least the minimum necessary for a healthy life. Healthy and sustainable places and communities, including housing, and strengthening the role and impact of ill health prevention. So, give every child the best start in life. We know that there's a social gradient in socio-emotional difficulties at age 3 and age 5 by the socioeconomic level of parents, richest, poorest. And this is adjusted for parenting activities and psychosocial markers. Parenting activities, reading to a child, talking to a child, cuddling a child, playing with the child. All of these follow the social gradient. They're less likely to happen the lower down in the social hierarchy. And that explains statistically about half of the social gradient at age 3 and at age 5 in socio-emotional difficulties. And these things track. Socio-emotional difficulties at age 3 and 5 are more likely to be correlated with mental ill health later in life. Ben Perks, who works in UNICEF, shared this slide with me. He said, adverse childhood experiences in a typical class in Central and Eastern Europe. So my previous slide was about the good things that parents do with children, parenting activities and so on. And the absence of those good things is correlated with socio-emotional difficulties. ACEs, adverse childhood experiences, are about the bad things. So in a class of 30 people in typical Central and Eastern Europe, but Ben Perks said it's rather similar elsewhere in the world. You'd have 4 pupils with 4 or more adverse child experiences, another 4 with 3, 5 with 2, this many with 1, and that many with none. Adverse childhood experiences are very common, but they're far from equally distributed in the population. If we look least deprived, most deprived, at all of these adverse childhood experiences, incarceration, drug abuse, sexual abuse, alcohol abuse, domestic violence, physical and mental illness, verbal abuse, parental separation, they all follow the social gradient. It's not that people in the least deprived are immune, by no means, but the lower you are in the hierarchy, the more deprived, the more likely it is to suffer adverse childhood experiences. And the audience that I'm talking to knows this much better than I do about the consequences. If you could prevent people suffering 4 or more ACEs, you could reduce early sex by 1/3, unintended teen pregnancy by 38%, smoking, binge drinking. Look at this, violence perpetration. Abolish 4 or more ACEs, and you could reduce violence perpetration by half. And violence victimization by half. The victims of domestic violence are likely to have had 4 or more adverse childhood experiences. And I said that They follow the social gradient. One measure of that is poverty. This comes from UNICEF, report card 16, published in 2020, not 220, published this year, just quite recently. And it's looking at poverty, where poverty is defined as having an income below 60% of the national median. So this is what's possible. In Iceland, the Czech Republic, Denmark, Finland, Republic of Korea, Slovenia, childhood poverty is 10 to 12%. In the UK, overall, it's 24%. Cold comfort, in the US, it's 30%. In arguably the richest country in the world, 30% of children are in poverty. But in the UK, we've got nothing to be proud of, 24%. Why do we not have it at 10 to 12%? We could do it. We know what to do. Adjust the tax and benefit system, and you've done it. Also from report card 16, 38 rich countries, the ranking of child well-being. 3 components: mental well-being, physical health, and academic and social skills. The top 5, Netherlands, Denmark, Norway, Switzerland, Finland, the usual suspects. And the UK ranks 27th out of 38 countries. The US ranks 36th. I will mention again, when people ask me, do we have the money to build back fairer? I see implicit in your question is you're quite happy for child well-being to rank 27th out of 38 countries. That's pretty rotten. It's not just the usual suspects that are doing better than us. Slovenia, which I showed you, has low rates of child poverty. Croatia are doing better than us, not to mention Germany and Japan and France and Italy. And part of what happened during the decade was this. If you look at changes in net household income due to tax and benefit reforms by income, so look at household income deciles, people in the poorest 10%, and look at working age families with children. As a result of changes in government policy, changes to the tax and benefit system, the poorest 10% will lose 20% of their income. And the next 10% will lose about 12% of their income. And then the richer you are, the less you lose. There's a bit of a drop up here at the very top. I showed a version of this graph to a former government minister and said, your government's policy was to make poor people poorer. And he looked a bit uncomfortable and he said, well, perhaps it was not our explicit policy. Well, they're very smart people in the Treasury. They must have told the Chancellor that this was the predictable effect of his policies. Now you see what I'm starting to get at when I titled my report that I published today, Build Back Fairer. And that distribution of income, making things worse, will make the social gradient worse. Other things equal, it's likely to make the social gradient in adverse childhood experiences worse, which will have adverse impact on children's development and mental well-being. And then during lockdown, what happened? Teachers were surveyed as to the effect of lockdown on their pupils. And in the least deprived of schools, 4% of teachers said their pupils were not behind at all. About 24% said they were on average 1 month behind. A bit over, about a third said 2 months behind. In the most deprived 10%, 6 months or more behind, more than 10%, 5 months or more behind, nearly 20%. You can see how the educational divide was being increased by lockdown. Food insecurity. Imagine yourself a parent and you don't know whether you're going to have the money to feed your children. What impact does that have on your mental health as a parent, which in turn will have impact on your children's mental health? So this is 3 or more children, food insecurity pre-COVID-19, and then March to August, and 2 children. Younger females and males had higher rates of unhappiness and depression during lockdown. This is 16 to 34-year-olds, and a steep increase in rates of unhappiness and depression, and some increase, particularly for women at ages 35 to 64, and even at older ages. And the rates of psychological distress before and during COVID-19 lockdown. So that's before lockdown, that's after. For 18 to 24-year-olds, 25 to 44-year-olds. So you see the distress, which is much bigger in youngsters, and the impact of lockdown in absolute terms was huge. Gender, bigger effect in women than men, affecting both. All ethnic groups affected, and all educational groups affected. Weekly number of calls for service for domestic violence recorded by the London Metropolitan Police. This is 2019, and this is 2020, corresponding to lockdown. Increase in domestic violence. And we have a problem storing up, which is unemployment. It hasn't quite exploded yet, but it will when the furlough scheme finishes. And this is the rise of unemployment in 16 to 24-year-olds. It's rising in other age groups. And this will have a catastrophic effect on mental health. We know unemployment's correlated with suicide, and short of suicide, it relates to depression. And the lower the income, the more likely you were to be in a shuttered sector, a sector of the workforce that closed down. So these people lose their jobs. There's a furlough scheme that pays up to 80% of income. And these people keep their jobs and can work from home, and in fact can't spend money going to the opera or football or other things. So they're spending less money, still keeping their jobs, working from home, and getting richer. And these people are either in frontline occupations and getting poorer, or in sectors that have shut down and confined to a maximum of 80% of previous income. If you're on the breadline and you're only now getting 80%, you will be below the breadline. So the percent paid below the national minimum wage by region in England, you can see how it's gone up in every region, not furloughed and furloughed, and particularly hard hit are the Northeast and the Northwest. And changes in the number of people in poverty, particularly children, summer 2020, winter 2020, compared with 2018-19, and working age adults. So the Legatum Institute predicts, making assumptions about unemployment and the furlough scheme, that there will be big increases in poverty. And the ranking of local authorities in Great Britain, where employment recovery is likely to be hardest, you can see towards the north of the country, it's going to be much harder. These are areas that had higher deprivation levels and perilous occupations that were more liable to be shut down. Andy Burnham, the Mayor of Greater Manchester, was speaking at our launch seminar this morning, and he's suffering this for Greater Manchester. So what do we recommend? I said that health is a measure of societal success. Now, please read my report. You can see all the specific recommendations, but let's come back to my diagnosis. I said it wasn't a transformational idea, it was perhaps slightly fresh, of the 4 elements. And the first was governance. The Veracity Index. Ipsos Mori, a polling company, conducts this every year, says, now I will read you a list of different types of people. For each, would you tell me if you generally trust them to tell the truth or not? Regularly, every year, the most trusted group in Britain are the nurses. 93% trust nurses. And then doctors, 91% trust doctors. Engineers, teachers, judges, professors, scientists. So that's pretty good. Come on, you guessed this one, didn't you? Advertising executives, the politicians are very grateful to advertising executives. They're the only group that's less trusted than politicians. Only 15% trust politicians. And government ministers, 16%, below journalists who are just below estate agents. When I talk about quality of governance and political culture, I would say that the people at both ends of this scale, the nurses, doctors, teachers, judges, professors, and scientists, and at the other end, the government ministers and politicians and the journalists, they've earned their ranking. They've worked hard to achieve these rankings. The politicians really worked hard to make sure that nobody trusted them. And nurses are loved for very good reason. They're loved and trusted because they're terrific. I talk about quality of governance and political culture. What I'm showing you now is sheer speculation. There's something called the Social Progress Index, and I chose a measure, inclusiveness. We've done this for the UK as well, by the way, but I compared 3 countries: Germany, which handled the pandemic well, the USA, which handled it very badly, and Brazil, also very badly. So on inclusiveness, the US and Germany ranked highly. The US was slipping a bit and then took a bit of a nosedive in 2017. I'm guessing that nosedive began on January the 20th, 2017, and Brazil took a dramatic nosedive. Another index, personal safety. There's Germany, high. The US, a bit lower. Again, a dramatic nosedive beginning in 2017. Brazil was always lower. Now, Germany handled the pandemic well, the USA badly, and Brazil very badly. The UK looks more like the US than it does like Germany. So this is not even correlation, let alone causation. It's speculation, but I'm speculating that an index of social progress, how well the society is functioning, correlates with how well we handle the pandemic. And this is what I mean by the quality of governance and political culture. And the 5 least trusted professions, just repeating what I showed you: advertising executives, politicians generally, government ministers, journalists, and estate agents. So my 4 were poor governance and political culture, social and economic inequalities, and I showed you they were increasing pre-pandemic and have been increasing during the pandemic. The reduction in spending on public services, which was sharply regressive. And England was unhealthy coming into the pandemic. I called my report, Build Back Fairer. People ask, when can we go back to normal? And my response is, if by normal you mean the way we were before the pandemic, I hope never. I don't think the situation for mental health or physical health in February 2020 was ideal. To repeat, life expectancy improvement had slowed dramatically, ground almost to a halt. Health inequalities were increasing, and health for the poorest people outside London was going down. That's not a normal that we want to go back to. And social and economic inequalities were increasing. I think what we should be doing is putting a fair distribution of health and well-being at the heart of government policy. The New Zealand Treasury in 2019 said a well-being approach can be described as enabling people to have the capabilities they need to live lives of purpose, balance, and meaning for them. It might have been Amartya Sen, but it was the New Zealand Ministry of Finance. And they said, we have to put a well-being approach at the heart of government policy. And that's what I would like to see happen, but with the added part of equity, of fairness, of social justice. I was wandering in the mall in Washington, D.C., and came across this from Martin Luther King. I believe that unarmed truth and unconditional love will have the final word in reality. This is why right, temporarily defeated, is stronger than evil triumphant. We, colleagues, will get there. Thank you.
And thank you so much, Michael. That was, as advertised, stunning. And you bring these facts in, you bring your truth in such a modest and unassuming way, but in such a powerful way that you start wondering why isn't this something that is so obvious and so clear that there is no possibly moral reason for not acting on it immediately? So can I just ask you that uncomfortable question, which is, you have you have recognition. You have said it clearly in 2010, and the world went against us. Went against your recommendation. What is going on? Do you think that makes it hard for people to actually take the truth, the obvious truth of what you say, with the seriousness that it deserves, and it obviously needs to be acted on?
Well, the first thing to say, people often ask a version of that question: why aren't people listening to you? And my response is, there are 420 people on the participating in this event this evening, 420 people who want to listen. When we launched our report this morning, we had a seminar, there were 1,500 people who signed on at 9 o'clock in the morning. So a lot of people are listening. So the question is, why aren't the people in Westminster listening? And I don't know what goes through their minds. I mean, my suspicion is for the current lot, they were selected to be loyalists to Brexit. And anyone who's a loyalist to Brexit is not someone who's likely to be committed to social justice or equity or health or building a better society. I've never heard anybody make the case for Brexit in terms of creating the conditions for people to have better lives. It's all nebulous ideas of taking back control and sovereignty and God knows what, and moving for rich people, moving their assets offshore and to their economic base to Singapore and goodness knows. You can see I'm not a fan of Brexit, but we've selected for a cabinet that is unlikely to put social justice and fairness and health and well-being at the center. Now, that doesn't mean no one's taking it seriously. Coventry declared itself a Marmot city after 2010. We've been working with Coventry. Andy Burnham, the mayor of Greater Manchester, I went to see him. He said, well, if Coventry can do it, Greater Manchester can do it. We'll be a Marmot region. I said to them, my wife asked if you could call it something other than a Marmot region. She thinks this is malignant egomania on my part. And they said, too late, we're using the word Marmot all through the system now. I said, could you write to my wife and explain this? But the fact is, they're doing it. They're taking my reports and they're working on trying to apply it. We're talking to Cheshire and Merseyside tomorrow. Gateshead put out a plan for the future of Gateshead based on my recommendations. So the fact that the national government is not acting on it is regrettable and unfortunate, but it doesn't mean no one's acting on it. The voluntary sector, local government, regional government are acting on it. And my own view, with the 400 odd people on this call and the 1,500 who were there this morning, the more people who are actually committed to social justice and the practical actions that can be taken, the more likely we are to get a government that listens.
Mm-hmm. Okay, and I was actually reflecting a question that somebody asked. But to make it more specific, the way the questioner puts it is what is the ultimate goal of decision makers in dismantling public services? How can you justify it? Is there any, what you've made so clear is that any justification that's ideological is poorly found, but it doesn't generate wealth. Under Thatcherism, under Reagan, we lost, my reading of history, we lost the motivation to want to be equal. Isn't there something in us makes us want to be unequal? That inequality somehow appeals to the human nature, not the basis of possible way?
Well, maybe, but I don't think you're giving Friedrich Hayek his due. The Reagan-Thatcher revolution was planned. It was planned. These were people around Hayek. I mean, the jargon term is neoliberalism, but that was planned. It was people meeting for years and years, devotees of Hayek, saying, we've got to get rid of this state business, the road to serfdom, Hayek called it, the road to serfdom, that markets, Milton Friedman said, the moral purpose of business is to make a profit. He actually phrased it in moral terms. He used your language and he said, making a profit is moral. And by implication, taking social action for the common good was immoral. My goodness, he literally turned the moral universe on its head. But so you had economists like Hayek, like Milton Friedman, elaborating the whole idea that markets equals freedom, and anything else was an intolerable erosion of freedom. And now this is crediting some of our leaders with an ideology. I think some of them, that's actually giving them too much credit. But this was a commitment against the state and in favor of markets, and saying anything else is communism, serfdom, totalitarianism, the road to serfdom. So we're committed against the state and in favor of markets. Now look at how that's playing out now. It's not markets, but the so-called NHS test and trace system, which was put out to a company that's headed by Winston Churchill's grandson, Soames, the brother of the MP, Serco, is messing up the test, trace, and isolate system, whereas the government could have invested in local public health to do it, but it was somehow an ideology. I mean, I'm being kind by saying it was an ideology. Being less kind, it was jobs for their friends. But putting that aside, to the extent it was an ideology, it was an ideology that was directly opposed to the common good, directly opposed to social action. It was saying that that way serfdom lies. And so I'm trying to be kind to them by elaborating a philosophy. I think it was much less than that. If you read how the extreme right got organized in the US, this was not so much a philosophy as how to keep us rich. So the people who are making billions out of fossil fuels wanted somebody in the White House who would be against climate change. And George W. Bush was against climate change, and Donald Trump was against recognition of climate change. And that served the narrow economic interests of a very powerful group. So I think we've got some of that going on. There's some ideology which is antithetical to the public good. And then we've got narrow economic interests that are controlling politics. And both of those are running counter to what I'm talking about. Should be action at two levels. One is the commitment to social justice, to fairness. And the second is the practical actions that need to be taken to achieve it. And this ideology and these vested commercial interests run counter to the interests of the common good.
Let me ask, there's one challenging question that someone asked, which I never heard asked. Do you think there's a point after which greater equality will start to have negative impact on health and well-being? Or will it continue to improve until everyone has equal income?
Well, firstly, I'm not talking about equal income. I'm talking about greater equity of economic and social conditions, and which doesn't mean everybody should have the same income. So let me be a Democrat, a small d Democrat. When surveys are done of the population of how much do you think the chief executive of a large corporation earns, and how much do you think an unskilled factory worker earns? And the last time I looked at those figures, the ratio was about 12. People think the ratio that the chief executive of corporation, unskilled factory worker, that the ratio is 12. And then they're asked, what do you think it should be? And they say they think it should be 6. And the real figure is 350. So they think 12 is too big, a ratio of 12 times. They think it should be 6 times, but the real figure is 350 times. My goodness. So that's not arguing for equality of income. It's saying the population of England is not egalitarian. They think the head of a corporation should earn more, 6 times more than an unskilled factory worker, but not 350 times more. So firstly, I'm not only talking about inequality of income, and I can't foresee a society where we'd have equality of income, and nor is it what the population wants. They think it should be 6-fold. Fine, I don't know what the right number is, but why don't we work on that? That's what the population tells us it should. But I'm talking more about social and conditions, I've asked educational psychologists. I showed them some figures, the graph I had a few years ago, looking at GCSE performance by level of deprivation. And in the poorest decile, it was about 35% of kids got 5 GCSEs or more at C, B, A, or A star. And it was about 70% in the least deprived decile. So I asked educational psychologists, what do you think it should be, that 35%? If kids were performing up to their potential, what proportion should get 5 Cs at least? Well, they don't quite know, but they're pretty sure that they have the potential to get more than that and that they're not living up to their potential. Not everyone's going to do brilliantly well. We know that, and nor do I think everyone should go to Oxford or Cambridge. We know that too. But what we're seeing is inequity in social conditions, which means that poor kids are not given the conditions that allow them to flourish and to perform up to their potential. So that's not asking for everyone to be equal or even total equity of social and economic conditions, but improving equity so that the poorer kids have a better chance of leading a flourishing life.
It's very clear. Thanks. Been a number of questions on race. How do we deal with the reality of a politics that denies racial structuralism as a determinant of health and indeed, as you showed us, death?
Well, as I hope, no, maybe you won't have gathered by what I've said so far, but as I hope will come clear before our discussion's finished, I'm hopeful. I'm not a pessimist. I don't say everything's awful. I mean, I called my report Build Back Fairer. I didn't call my report Everything's Gone to Hell. I called it Build Back Fairer. Here we are. We can make a real difference. And I take heart from the Black Lives Matter movement. That was an outpouring, a relatively spontaneous outpouring in the United States that spread to the UK. We suffered from the delusion that we didn't have racial problems in Britain, that we were wonderfully tolerant people and that we weren't prejudiced and everything was just fine. And we suffered from that delusion. And I think 2 things recently changed that. One was the Black Lives Matter movement spreading to the UK. And the second was COVID-19, that incredibly high mortality from COVID-19. We could no longer push it under the carpet. And that's why I said when I was asked on the BBC, what was your response to those figures and what do we need to do? My response was, we need to deal with structural racism. And I had nearly a stand-up argument with a close friend of mine going for a socially distant walk on Hampstead Heath. And he said, oh, come on, I thought you were more nuanced and intelligent than that. Why are you talking about structural racism? And I said, ask any young Black kid on the streets of London, has he been stopped by the police? And even if the police were not consciously and overtly racist, even if they were somehow profiling on the basis of risk, but young Black kids were getting stopped disproportionately, the effect is as if they were racist, and the effect on the Black kids is precisely they've been suffering from racism. And we can then go through what happens in school, what happens in workplaces. So I don't blame Oxford University for not admitting more Black students. I blame our whole system from early childhood right through the system. We want more kids from Black, Asian, and minority ethnic groups. Now, you notice when I showed the COVID data, I mentioned Black African, Black Caribbean, Pakistani, and Bangladeshi, but not Indian. It was somewhat higher in Indian, but as you know, Peter, in various measures of performance, the Indian kids do better than the white kids. So it's not, you know, if you're a racist and you say, well, if you've got brown skin or non-white skin or something, you can't, I mean, it's garbage. It's just wrong. It's contradicted by the evidence. And there are good reasons why the Indian kids might do better than the Bangladeshi kids, because they come from more affluent backgrounds and so on and so forth. But it's very different. And it means, my starting position is we can change that. That there's no reason why a Bangladeshi or a Pakistani kid, given the same social conditions, wouldn't do as well as an Indian kid.
On that positive note, though, a number of people ask, what can we do as individuals? Many of the people attending this are healthcare practitioners. What can we do as mental health workers? What can teachers do? What can we do to tackle the difference in the inequity, the inequality at an individual level? Can we do anything?
Yeah, a great deal. And I've been asked that by doctors and nurses, what can we do? And so my response was, we prepared a report when I was president of the BMA, and then again when I was president of the World Medical Association, on what doctors can do. And now my colleagues in the nursing profession have prepared a report, similar report, on what nurses can do. We say 5 things: education and training. So educate yourself, and if you're in the position of an educator, educate and train the younger people coming through. Second, see the patient in broader perspective. If you're a practitioner dealing with a rough sleeper, do you say, well, okay, we'll try and patch him up and then send him back onto the street? Well, you don't. You see the patient in broader perspective. The third is the health system as employer, and we might say anchor institution. So the quality of working life for people employed in the system, but also the impact of the health system on the local population. The fourth is working in partnership. And when I was doing the original Marmot review, the 2010 report, we linked up with the police and the firefighters. Firefighters in Merseyside, they go into a house and to talk about fitting smoke alarms, and they suspect domestic violence. And they don't say, not my job, Gov. They say to themselves, I don't know how to deal with this problem, but I know who does know how to deal with this problem. And they contact the appropriate professional. So working in partnership. And pediatricians understand that, working with young children. Child psychiatrists understand that, working with young children. And the fifth is advocacy. I talked about us, all of us, changing the position of governments. Now, as an individual, you can't do it on your own. We never got big social change by individuals. We get it by building social movements. So what you as an individual practitioner can do is be part of a social movement for change, and just go back to the veracity index. Think how trusted nurses and doctors are. And there's probably no item for psychotherapists or whatever it is, but you know, you're up there presumably with the nurses and doctors. So you're trusted for good reasons, because you're motivated for all the best reasons. And that means creating, being part of a social movement, the importance of the voluntary and community sector, of civil society groups to make a difference. Look what a young footballer did. If you ask what can individuals do, what a 22-year-old footballer did, he changed government policy on free school meals. So get right on your side, become part of a social group, and you can change the world.
One, Kate Heiter, who's a community psychiatrist, asks, says, I'm worried that digital consulting, if maintained, will further exacerbate inequalities, particularly in access to mental health. Do you have any evidence on that?
I don't. And I suspect that at some point, touching physical presence is probably good. Most people I know would long to be hugging and cuddling and, with their friends and kissing and goodness knows what. And I'm sure at some point that's important. Doing things digitally is certainly better than not doing them, but is probably not quite as good as the real deal. But I have no evidence on it.
Yeah. I mean, I rather suspect that certainly social media maybe is able to do good, but what we see is it doing harm in spreading and undermining the veracity of politicians even further than it does. If there was no floor effect there. I wanted to ask you something. We are at the Anna Freud Center. So if I didn't ask you this, I wouldn't be doing my job. How do you think children and young people can play a role in tackling social determinants of health? And how can we engage children and young people in a process of reform?
Well, it depends how young is young, but who last year made the biggest contribution to consciousness on climate change globally? And how old was she? She shamed the world, didn't she, Greta Thunberg? She's very old, she's a schoolgirl. And she has moral fervor on her side. And to come back to what I said, she's part of a social movement. I mean, yes, she's a remarkable individual, but supported by a social movement. So young people have a very powerful voice because they're young people. You've got to be a pretty miserable, grisly cynic to say, oh, the motivation behind those young people is somehow bad. You may say, well, they're young, they'll grow out of it, or they're misinformed, or you may be critical of them for a variety of reasons. But by and large, they're highly motivated with the best instincts to do good. So they've got right on their side, but they've got sympathy on their side. So I think, I'm not talking about 5-year-olds, I'm talking about perhaps teenagers. But I think teenagers have a huge role to play and can be a wonderful force for good.
Well, Michael, our time is unfortunately drawing to a close. I want to thank you, not just for this fascinating talk, this brilliant talk, which, I've heard you talk a number of times, and you are an incredible communicator. But I want to thank you really on behalf, I think, of all of us here for your lifetime's work, for what you have done as an individual, as one person, all of us. And if Manchester is renamed after you, I would not be sorry, personally. No, doesn't matter what other members of your family might think. But I hope also that, like me, everyone else has enjoyed Michael's talk. And I hope that you'll be able to join our next seminar that will be given by Professor Louise Arsenault, and it will concern the impact of social relationships on mental health, not a million miles away, perhaps a little bit further, closer to the ground than Michael is able to achieve. But it nevertheless will, I'm sure, open our eyes to other things that we really should and need to know. That'll happen the 19th of January at 5:30. The information is on our website, and you do fill in the feedback form, which you'll be directed to once the seminar has finished. But finally, Michael, just remains for me to say thank you very, very much for really a very entertaining, but also very, very important evening. And I know you had a bit of a day of it, and you did an incredible job for us. Thank you so much.
Well, thank you. My pleasure. Thank you.
Thanks.